Challenges are inevitable part of life.
But to consider those challenges as problems is an option.
Because when you have a challenge, you have few options. Option 1 is blame the situation. Option 2 is blame the individuals responsible for that situation. Option 3, live with that situation. And option 4, outgrow the situation.
I always believed in option number 4, which is outgrowing the situation by converting the problem into an opportunity. From the time I was very small, 8.5, 9-year-old, due to paucity of money, I used to take in wholesale common goods like soap, hair oil, biscuits from stockists and sell it on my bicycle whole day to small shops, making the margin profit for my family. At that time, my weight was about 30 kilos and I was carrying 60 to 80 kilos, 100 kilos. I was carrying weight almost 2.5, 3 times of my weight, selling those goods whole day.
जब मैं देखती हूँ, यहाँ पे आती हूँ, तो हर बार नई नई चीज़ दिखती है तो बहुत ज़्यादा खुशी होती है और अपने आप में भी मुझे बहुत गर्व महसूस होता है कि हमारे भाई इतने कर रहे हैं। जब भाई साइकिल पे सामान लेके बेचने के लिए जाते थे तो दुख भी होता था और अच्छा नहीं लगता था क्योंकि वो बहुत छोटे थे उस समय और बहुत मेहनत करते थे उस एज में भी।
When I used to work in hospitals, we realized that almost every medical equipment in our Indian hospitals are imported. And when they are imported, they are not only high cost, which means we don't have the best, and a lot of them, but also when they break down, there is nobody to repair. And therefore, I thought a seed of idea came in my mind that why can't we make medical equipment? That's how AMTZ started, with that thought.
Succeeding life, you have to do 4 things. Number 1, I will have great aim. I will continuously acquire knowledge. Or I will do hard work. I will persevere and succeed. That's the mantra.
After I completed my 12th standard, I got an engineering seat, medical seat, but not a single rupee to join any of them.
Just then, I read a magazine and it had an advertisement of higher education from Satya Sai University. The beautiful thing was, it was mentioned that the university doesn't take fees. I had one torn t-shirt, a towel, and from Chitranjan, which is in West Bengal, I travelled to Puttaparthi 3.5 days, stayed in a shed, slept on the towel, wearing that t-shirt, and wrote the entrance exam for Satya Sai University. Fortunately, I got selected. People who come from a background like mine, we got food to eat and a place to live called hostel. Puttaparthi gave me free education and life, and best of the teachers, all those teachers who made me what I am today. If there are defects in me, it is because I have not learnt well from them. And if there are good things in me, it is blessings of my teachers. Overall, I am a product of my teachers.
Once, when I was sitting in the Darshan hall in Puttaparthi, and I was chanting mantras, the Ved mantras, Baba came near me. Generally, when Baba would say something, we would go close to him to listen to what he was talking. Baba looked into my eyes and said something. I thought he was talking to me, so I tried to go close to him. But he stopped me, saying that he was just repeating what was being chanted. At that time, what was being chanted was Saraswati Gayatri. Baba was looking straight in my eyes and repeating Saraswati Gayatri. I feel 3 PhDs to a person who did not go full-time to school, or this particular episode is responsible for the blessing of education that I received in life.
After I completed my education in Sri Satya Sai University, I was waiting to take guidance from Sri Satya Sai Baba. And during that time, as Puttaparthi is a spiritual place, I had by then started learning Vedic chanting. And I was so enamored by the Vedic chants that I wanted to become a Ved Purohit. That had become my career goal. So more than 16 hours a day, I would be chanting Vedas in Puttaparthi.
Abantanajato Vishtar Vichakrame Vrujya Saptadhamabhihi Idam Vishnah Vichakrame Prethani Dathe Padam Samolhavasyava.
And I actually went to Tiruvannamalai and joined a Vedic school as well under Veda Guru, Shri Vishnu Narayan Sabahit ji, and I started learning Vedas. So for a few years, I did only Vedas, nothing else. Hours and hours and hours a day. And then one fine day, because I had completed my Masters in Hospital Administration, Baba called me and asked what I have studied. And when I told him that I have studied Masters of Hospital Administration after my graduation from Puttaparthi University, he asked me to go and work in the Satya Sai General Hospital. The medical superintendent of that hospital, Dr. A.N. Safaya, who is known as the father of hospital administration in India, having lived a distinguished career in AIIMS New Delhi, he was the director of the super specialty hospital and the medical superintendent of the general hospital. So Baba asked me to go and work with him, and I became the administrator of the Sri Satya Sai General Hospital under Dr. Safaya. One day, Dr. Safaya called me to his office in the super specialty hospital, and looking at several bundles of paper, told me that you have a streak of madness in you. You must go to the All India Institute of Medical Sciences, New Delhi, and get trained further. The Department of Hospital Administration AIIMS at that time was led by another guru of mine, Dr. Shakti Gupta.
Jitendra Sharma is a very dynamic. He takes initiatives, he thinks out of box, and he wants to deliver. And especially he wants to innovate certain things. Yes, actually I was very confident of him, and I believe in him also. I am very confident that whatever he wants to do, he can deliver actually. And that too in a very short time actually. At one place he wants to bring certain changes which can help the country to grow and take the country to the next level.
Because I was not a direct recruitee, I was initially not entitled for an accommodation. And Delhi is a very expensive place. I was lucky that somebody who had a school or was managing a school offered me a place, but the place was one of the classrooms. In the third floor classroom, we put together a wooden bed. I would sleep in the classroom. I would start my day at 7 in the morning, come to Department of Hospital Administration AIIMS, and I had taken approval from my professor Dr. Shakti Gupta to do a master's in health economics and health financing. Generally, a practicing fellow does not do a master's at the same time, but Dr. Shakti Gupta gave me the freedom and said, if you can manage, he will manage. I went for a project to the University of Adelaide in Australia. So my career went from Puttaparthi to AIMS, AIMS to Australia, Australia to the US, and eventually I joined the World Health Organization headquarters in Geneva as a consultant advisor on health financing and medical technology.
By the time I was in Geneva, I was fairly trained with few masters, and eventually I ended up completing 3 PhDs, one from MATS University Raipur, one from Tata Institute of Social Science Mumbai, and one from VU University Amsterdam. I still remember that when I decided to leave from Geneva, a very senior administrator in the World Health Organization came and asked me, "Am I truly leaving from Geneva?" And I said yes. As an excuse, I told that person that I have already vacated my house, and he said, "You can come and stay in my house." But I chose to come back to New Delhi to join the Ministry of Health in New Delhi. Just then, I got to know that India does not have a department or center for medical technology. And I was given the opportunity by the Director of National Health System Resource Center in the Ministry of Health, Dr. Sundaraman, a wonderful teacher again, to come and set up a healthcare technology center.
To address this situation, I propose to start a national dialysis service program. Funds will be made available through a PPP mode under the National Health Mission to provide dialysis service in all district hospitals to reduce cost.
In the National Health System Resource Center, after setting up the Department of Medical Technology, I was instrumental in designing several national programs like the National Dialysis Program, National Equipment Maintenance Program in PPP modes. These programs were conceived and designed by me in consultation with ministry and experts and implemented across the country, supporting state governments. Now, when we support state governments, apart from helping them in implementation, we also come for supportive supervision, audits, and so on. In one such visit, when I was visiting Andhra Pradesh, the meeting was being chaired by the Chief Minister, the Honorable Chief Minister, Mr. Chandrababu Naidu, a visionary leader himself. When I mentioned to him the lacunas in the program implementation, I was not just mentioning the limitations, I was also giving solutions. I was also suggesting what could be done better. He was so happy that when I went back to Delhi, I got a call the next day requesting if I could resign from Delhi and come to Andhra Pradesh. Since the Delhi center was new and it was not right for me to resign at that time, 2015, I had come in 2012, so soon as the center was maturing. And therefore, I asked to be excused, to which the Honorable Chief Minister sent a message that if I cannot resign my job and come to Andhra Pradesh, at least I should accept to be the advisor to the government for health and medical technology. Since it was a non-executive role, I readily accepted, and I continued supporting Andhra Pradesh as well as my center in the National Health System Resource Center. As more and more programs were designed, developed, we realized that most medical technology is imported. And therefore, I proposed to the Chief Minister as well as to the National Center if we could create a large enterprise which can produce medical technology. And when I explained to him the entire concept of AMTZ, he asked me who would run it. And I said, we would take best of the people, we would advertise from Delhi and run it. And he said, no, this is your idea, you lead it. That's when in 2017, I resigned my job in Delhi. And on 4th of January 2017, I came to start AMTZ in Vizag city in Andhra Pradesh. When we started AMTZ was a barren patch of land without a phone signal and a pin code, no water. Our first office was a truck container 40 by 8 feet. I anticipated AMTZ to be a cluster of factories, few R&D centers, few testing labs. What we have achieved in AMTZ has far exceeded that original plan. But today we have world's only WHO Collaborating Center for Health Innovations. We set up Dr. APJ Abdul Kalam Institute of Health Technology in the name and honor of our beloved Dr. Kalam. We have set up World Trade Center AMTZ, which was not even in the plan. We have set up a convention center. We are setting up a university which is going to be world's only university dedicated to teaching of medical technology. Now these things did not exist in the original plan, but we constantly learned and built the ship while sailing. Today, AMTZ is a home to 6,000 people. It is a place of livelihood to over 15 to 20,000 direct and indirect employment. It is a home to making of 1,200 products, home to 145 companies, and world's largest medical technology industrial park. Now this enterprise called AMTZ, with hundreds of private sector entities, several ministries having their center of excellences set up in this zone, producing more than 1,200 products, is the only campus in the world to be making from a mask to an MRI machine, from a ventilator to an operation theater light, from a surgical instrument to a heart-lung machine. This enterprise, this cluster, is also the only cluster in the world to have a WHO center and a World Trade Center. Now what does this mean? This 10,000 crore worth of cluster turnover enterprise, it means that an MRI that we used to import for 6 crores, today we are able to export for 3 crores. It means that a small hearing aid that we used to import for 15,000 rupees, today we are able to produce for 2,000 rupees. It means that a ventilator that we used in COVID, that we used to buy for 10 lakh rupees, can be produced here for 2 lakh rupees.
One small initiative has created a history. Man behind is Sharma ji. I really appreciate him. I congratulate him. Really, I am proud of him. If I give some idea, he will create a model. And with precision, he will execute that model. That is how so many models, nearly 25 initiatives, 28 initiatives in public health were taken. All are creating excellent impact. Always, his mind is factory for ideas and innovators. Always he is ahead of time.
The futuristic technology, which is going to be new India, Atmanirbhar Bharat. You are really the pillar of Atmanirbhar Bharat, and particularly Dr. Jitendra Sharma. I always telling to him that there are some people who convert problems into opportunities, and there are some people who convert opportunities into the problems. But you are represent that you convert problems into opportunities. You are very good.
AMTZ is a rainbow. What does this rainbow do? It colors the manufacturing and technology landscape. What are the components of this rainbow? The first component is the land infrastructure, development with water, power, sewage, fiber optic cable, and a single window clearance to support investment. Color number 2 is the supply of critical components like sensors, photodiodes, scintillators, detectors, without which medical technology manufacturing wouldn't be possible. That value chain is provided by AMTZ. Component number 3 all the accredited laboratories that are required for medical technology testing is offered by AMTZ. Color number 4 or component number 4 is when you produce medical technology, you need to skill the engineers to install and use the medical technology in the right way. And the Indian Biomedical Skill Council that operates out of AMTZ does that role. Our component number 5 of this rainbow is the market access support that the sales team of AMTZ gives to the producers that are occupying factories and R&D spaces in AMTZ. We help them in market access. Component number 6 is the Bureau of Indian Standards teaching, training and development of standards that are done at AMTZ, so that as we produce, the development of standards are also done in the country, so that our products are benchmarked not only to Indian but to internationally harmonized standard. And component number 7 is the international institutionalization of World Health Organization, World Trade Center that allows our businesses, our engineers, doctors, scientists to connect with the rest of the world to make India the best place for medical technology and Indian-made medical technology products as globally accepted, good quality, but most importantly, affordable medical products. 18 high-end centers that are needed for medical technology. If there is one campus in the world, it is AMTZ. That's our story of going from 10,000 rupees to 10,000 crore in 5 years and making India a global leader in medical technology.